Hey, we are talking all about how to give birth naturally after you've had a C-section. This covers everything that you need to know about how you can VBAC. I'm Annabelle, RN, BSN, birth doula, and mama, and I'm here to build your confidence in birth. Make sure you subscribe to my channel and ring that bell to stay up to date to my latest content. For you to VBAC, which stands for vaginal birth after cesarean section, you need to start actually with TOLAC. TOLAC, this means trial of labor after cesarean section. So this means that you have decided, okay, I had a C-section in the past, now I want to try to give birth vaginally, and so you are going to have a trial of labor. If you can successfully TOLAC and give birth vaginally, then you have been a successful VBAC mama. In the past, there was this thought process that once a C-section, always a C-section. Obstetrician gynecologists felt comfortable if moms have had a C-section in the past saying you're gonna have a repeat C-section. But that did not show the best outcomes for mom or baby. C-sections are major abdominal surgery, and just because mom had one in the past does not mean that she has to have one now. Studies show in ACOG, which is the American College of Obstetricians and Gynecologists, say that VBAC is a safe choice for mom and baby, especially when mom has a low-risk pregnancy. And the studies themselves show that mom has a 60 to 80% success rate for VBAC. Again, when she is especially low risk in her pregnancy, meaning that she does not have things that put her in the high risk category: gestational diabetes, obesity, having a BMI of greater than 30, being over the age of 40, having an underlying health condition that puts mom at high risk in her pregnancy. So if you don't have any of those things that put you in the high risk category, you are especially in that group of women that have that 60 to 80% success rate. And that should be so encouraging to you if you are on this road to thinking, I want to experience a vaginal birth with this baby. Who is a candidate for VBAC with a low risk for complications and a high rate for success? Ask yourself these three things. What is the incision on my uterus? You can't know that by just looking at your belly. You need to look at your health records or talk to the healthcare provider that did your surgery. Optimally, we want you to have a low-transverse incision. This means it's a horizontal incision on your uterus. Classical incisions were vertical, up and down, but if mom were to VBAC with a classical incision, she is at higher risk for complications when she VBACs. So a low-transverse incision. How many C-sections have you had? Optimally, we don't want mom to have more than 2 C-sections in the past if she is going to be a candidate for VBAC. And thirdly, do you have a healthcare provider that is on board, that's ready to be a part of your team and is ready to help you successfully VBAC? But there's a few other things that can really increase your rate of success when you VBAC. So I said, how many C-sections have you had? And optimally, we don't want you to have more than 2, but you have an even higher success rate if you have only had 1 C-section in the past. Does labor start on its own? This is something that when you get to your due date, you want labor to start on its own and really get going and get that momentum without having to be induced. This will increase your rate for success when you VBAC. Do you have a proven pelvis? This means, have you had a vaginal birth in the past? So some moms give birth vaginally, then they have another baby and they have to have a C-section, and now they're attempting VBAC. That mom has a proven pelvis. We know that she can give birth vaginally. We know that the birth canal is able to do what she wants it to do. But moms that don't have a proven pelvis, we don't know yet. We don't know if your pelvis is the right shape and size for your baby to come down the birth canal. So you're at a higher rate for success if you have a proven pelvis. And the last 3 things that increase mom's rate for successful VBAC: mom's age, being under 40, mom's weight, having a BMI of less than 30, and baby's weight. Which baby's weight we don't exactly know. Doctors will do sonograms and say baby's big or small, but we don't really know accurately baby's weight until baby's born. So those 3 things as well will determine if mom has a high success rate or lower success rate for VBAC. What is the risk associated with VBAC? Uterine rupture. This is where the contents of the uterus, where baby is living during your pregnancy, all of those contents spill out into the abdomen because of that incision from the C-section. This is very dangerous for mom and baby, but it is a tiny percentage. About 1 in 200 women will experience uterine rupture. Very tiny risk, but that is why I always encourage mamas that are attempting VBAC to be in the hospital, where there's a doctor on site, all the equipment is there in case of that emergency. But it's also important to know that if you're attempting to VBAC, so your trial of labor after C-section, that some moms do still end up having a C-section for other reasons other than that big risk uterine rupture. Labor might have not been progressing. If mom's pelvis is not seeming to be the correct shape to give birth vaginally, there are other reasons. But I do want to say that just because you have been told you have a small pelvis in the past, oh, look, girl, you have tiny hips, something like that. I've heard that a lot. That doesn't mean that you cannot give birth vaginally. Small hips does not mean you can't give birth vaginally. There's plenty of moms that have narrow hips that do give birth naturally and vaginally successfully. But going into your VBAC knowing, okay, there is a risk of uterine rupture, it's a tiny risk, but there are other reasons that could lead me to have a repeat C-section. Now I'm going to give you my tips on how you can successfully walk down this road towards your VBAC dream. Number 1, make sense of that C-section birth and know that this experience is new and it can be different. Making sense of it means learning about that experience, going to that healthcare provider and asking, what was the reason that I was taken into the operating room to have a C-section? A lot of moms are told a brief answer in the labor room, it's an emergency and we just need to take you to C-section, and that's all they know. But really sitting down, looking at your health records and talking to your doctor about why labor wasn't progressing, was baby in danger? What was the reason? Was it a reason that is probably gonna happen again because of maybe something that goes on with my pelvis? Or is it a reason that I can be in control of? That I had induction of labor and I was in labor for hours and baby just looked like he or she was in distress on the monitor? Was it because I wasn't moving around enough in labor to get baby to come down the birth canal? What was the reason? Making sense of that while you educate yourself with your history, and then also making sense of it just with a peace of mind inside of you that you are not at fault because of what happened, but that there might be things that you can do differently in this birth experience to be in control of the situation. Next, you need to decide that you are going to VBAC. So you know the history of why that birth happened the way it did, and now you're saying, okay, I'm going to have this peace of mind that I can do this. I'm going to walk down this road, that I'm going to be calm. I'm going to get prepared. I'm going to start asking questions. What is the incision on my uterus? How can I continue to prepare for a vaginal birth? What do I need to do to get in the right state of mind and know that I'm a candidate and that I can do this? Next, you need to find a supportive healthcare provider if your current healthcare provider, the one that did your previous C-section, is not supportive of VBAC. You need to ask your healthcare provider, how do you feel about VBAC? What is your overarching idea of C-section, vaginal birth, natural birth, etc.? You want to make sure that you kind of get that feel before you even go any further. Then asking, what is your rate for VBAC? How many women do you have come in and say, I want a VBAC, and you go down that road with them? In that group of women, what is your VBAC success rate? So all these women that say, I want a VBAC, you go down that road with them, how many of those women actually are successful when they VBAC? They don't just have trial of labor after C-section, they actually have VBAC. Asking what the rate of C-section is for that doctor, you can really get a feel there about how comfortable they feel with vaginal birth. When situations get a little fuzzy with vaginal birth, do they just rush right to the operating room, or do they really wait it out and help the mom give birth vaginally? An underlying question to that is asking that provider about their induction rate. How many moms do they induce? Because induction is really something that can lead down this road to C-section. We want to get labor going. If the body's not ready, then we need to do more interventions, and then mom might end up in C-section. And when you are going to VBAC, you want to try as much as you can to allow labor to get started on its own. We talked about that being something that really increases your rate for success. If your labor can get initiated on its own and baby is ready to come down your birth canal and into this world, you have a higher rate for success in your VBAC. And lastly, this has to do with your hospital. Calling the location where you are going to VBAC and asking them, what is their C-section rate? What is their VBAC rate? How does their philosophy fit with VBAC? Are they comfortable with that? Are your nurses trained to support moms with VBAC? Very, very important. And lastly, what is your readiness when it comes to going towards your VBAC? I always encourage moms, whether they're giving birth for the first time, if they're trying to go down this road to natural birth, if they want a VBAC, whatever it is, you need to be ready. And this means getting a birth plan. What do you want to do? What is your end goal? Where are you going? And how do you get a good birth plan with VBAC that really suits your body and what has gone on in the past with your births? That goes to a childbirth class, really getting yourself educated with someone who is trained, someone who knows about vaginal birth and really can give you all the tools that you need to go down this road successfully. And I really encourage you to have a really good birth class, a childbirth class with a good community, other moms that are in that community that are on the same road as you are and can inspire you and really encourage you. Do you have someone who is going to be continuous birth support for you? Very important in any vaginal birth, but if you are attempting vaginal birth after a C-section, you need someone there telling you you can do this. And this continuous support will decrease your risk for C-section, decrease your risk for having an assisted delivery, decrease your risk for induction, and decrease your risk for asking for any sort of pain medication during your birth. And lastly, this goes back to your healthcare provider who is a part of your team. Make sure that you have a healthcare provider that's on board, is ready to educate and encourage you through this whole process. I hope this video was helpful on VBAC Mama. I am rooting you on. You can do this. If you want to take the next step with me so that you can give birth naturally, check out my free workbook in the description below. I'll see you in the next video.